Hello, my name is Alex Camacho. I'm the Regional Advisor on Emergency Preparedness and Disaster Risk Reduction at the AMRO office of WHO based in Washington, D.C. For me, it's a great pleasure today to sharing with you some key concepts and basic aspects on health, emergency, and disaster risk management, as well some available resources. But of course, one of the key aspects that I want to highlight is the importance of community engagement and, of course, the whole society approach. As you know, during 2015 and 2016, several global frameworks were established. One of them is the Sendai Framework for Disaster Risk Reduction 2015-2030. The four priorities of the Sendai Framework are pretty aligned with the needs and that all the countries demonstrated during several platforms around the world. The Sendai Framework has a lot of key health aspects that are directly related and interrelated with international health regulations framework established in 2005. Especially the Sendai Framework in the health part has some contribution and a very important aspect on mortality, reducing the injuries and illness in people, and of course, also contributing to reducing the damage of health facilities as well, the disruption of health services. The Sendai Framework for Disaster Risk Reduction, as I mentioned, has a relation as well with the Paris Agreement, with the Sustainable Development Goals, as well as others. So these are the global frameworks that are that we have to take in consideration by the time that we want to improve the health, emergency, and disaster risk management. Now I'm going to talk about some key concepts, specifically one of them related to prospective disaster risk management. So, as you know, disaster risk management is the application of disaster risk reduction policies and strategies to prevent a new disaster risk, reduce existing disaster risk, and manage residual risk, contributing to the strengthening of resilience and reduction of disaster losses. Prospective disaster risk management activities address and seek to avoid the development of new increased disaster risk. They focus on addressing disaster risk that may develop in future if disaster risk reduction policies are not put in place. Examples are better land use planning or disaster-resistant water supply systems. A key aspect, I will say, that is regarding the urban and rural planning. Specifically those aspects that can prevent the appearance of new risks. It's also important to know that we have an emerging concept that is now more important than ever, that is the corrective disaster risk management. So what happens if the health facilities infrastructure, for example, are already built? So corrective disaster risk management activities address and seek to remove or reduce disaster risks which are already present and which need to be managed and reduced now. Examples are the retrofitting of critical infrastructure or the relocation of exposed populations or assets. A very important initiative on this is the Safe Hospital initiative through the using of the Safety Hospital Index. It's a very important tool that can allow the managers of health facilities, for example, to know what is the structural, non-structural, and the disaster risk management vulnerability. So when we are talking about corrective disaster risk management, we are talking about mitigation. Corrective disaster risk management, as I said, address and seek to remove or reduce disaster risks which are already present and which need to be managed and reduced now. Again, I want to emphasize this concept. So there are several examples around the world on mitigation in health facilities, and all of them have been successful. For example, in the Caribbean, in the Americas, a very important initiative is being put in place but not only in the safe structural aspect, but also in reducing the carbon footprint that HEDRM facilities may produce. So there is an important initiative in terms of mitigation, but also addressing climate change, reducing the consumption of energy and water, but also, as I said, reducing the carbon footprint that these facilities may produce. Also, we have compensatory risk management. What happens if we cannot prevent? What happens if we cannot mitigate, correct that risk? So we have the residual risk. So compensatory disaster risk management activities strengthen the social and economic resilience of individuals and societies in the face of residual risk that cannot be effectively reduced. They include preparedness, response, and recovery activities, but also a mix of different financial instruments, such as national contingency plans, contingency credit, insurance and reinsurance, and social safety nets. Since the concept of the disaster risk management cycle has emerged so many years ago, it is still present. And the best way to contribute to the resilience of the health systems and services is to take the emergency disaster risk management as it is. We need to start with a very comprehensive strategic risk assessment. There are several tools like the STAR tool promoted by WHO that help you to categorize and to identify the risk that a country can have at the national, subnational, and local level. And I cannot imagine a country or a health sector planning without a proper strategic risk assessment. So that's why it's so important that we can apply the correct policies and strategies to prevent new disaster risk, to reduce existing disaster risk, and manage residual risk, contributing to the strengthening of resilience and reduction of disaster losses. So we still have to consider, so we do have reduction phase, preparedness, response, and recovery. And recovery maybe can be divided as early recovery, rehabilitation, and reconstruction. If we see this is the before, the during, and after an emergency or disaster that we have been listening for so many years. And when we are talking about preparedness specifically, also to remember the preparedness cycle that starts with a proper planning, that of course the strategic risk assessment will give us that possibility. And then we go to organizing, capacity building, exercising, and the evaluation and improvement of the activities that we have identified properly. So when we address health, emergency, and disaster risk management, the preparedness should be applicable to large or small, frequent or infrequent, slow or developing or sudden disasters, with an all-hazard approach, taking in consideration that we must do this action on a multi-level basis, and also with the participation of all sectors and all the disciplines, so interdisciplinary as well. As I mentioned before, the strategic risk assessment for all hazard is a very important tool that the WHO has been using in so many countries and around the world. We believe that is one of the most important tools that have been developed, not only because of its practicality, but also because it gives you the opportunity to identify what are the actions that need to be addressed now, and also how can you strengthen different aspects in terms of taking care of those high priority risks. So when we are talking about an all hazard approach, we mean that we have to identify those all hazards. How can we do it? Through the STAR tool, the disaster risk assessment. So we can identify those hazards, prioritize them, but also to evaluate the preparedness capacity. When we have this assessment completed, so we can step on the all hazard approach. What is the all hazard approach? Basically a model for tackling those hazards. In some countries, you will hear that maybe a multi-hazard response plan. An all-hazard response plan It doesn't matter how you call. The most important part is that we need to identify the response functions, and also that the persons that will be executing them are the ideal actors and the most efficient ones for utilization their resources and capacities to reduce the risk and, of course, to better response and to better recovery. So when we address in an all-hazard emergency disaster risk management approach, it will be more easy to identify what are the actions and the functions that we have at the beginning of the emergency. It means how we can easily activate the response, but also what are the aspects that may be a key during the response, but also when will be the most feasible time to reduce the response and start the recovery process. Now, I would like to refer to the Health Emergency and Disaster Risk Management Framework. The guiding principles of Emergency Disaster Risk Management Framework have been built with the participation of many experts around the world, and basically it helped us to understand what are the key elements that we need to address in a health sector to reduce and to contribute to the Sendai Framework goals, as well to strengthen the capacity in the IHR framework. So I was mentioning it is important that to mention that the Health Disaster Emergency Management Framework has several guiding principles. Risk-based approach, for example, a comprehensive approach across the emergency management cycle, as I mentioned before, an all-hazard approach, an intersectoral and multidisciplinary collaboration, but also the most important part, the participation of the community and the contribution to strengthen the resilience. The integration of health, emergency, and disaster risk management framework also with health system strengthening. It cannot be apart. It has to be together. And of course, also it's important to take in consideration the ethical aspects. What are the essential components of the health, emergency, and disaster risk management frameworks? Policies, strategies, and legislation, planning and coordination, human resources, financial resources, information management, risk communication, health infrastructure and logistics, health and related services, community capacities for health, emergency risk management, and also monitoring and evaluation. So when we are talking about a whole society emergency disaster risk management, we are talking about interdependency towards sustainable capacity development for resilience, where we have the participation of all the actors, not only international actors, national government, multi-sector, but most important, community, the civil society, the local governments, the stakeholders who really contribute to strengthen that resilience. So around this, we have the participation, the communities, the WHO and partners, the local governments, and in the center, we can say that is the health system and the health, emergency, and disaster risk management framework contributing to this. So the vision must be to improve health outcomes for people at risk of emergencies and a stronger community and country resilience. We have to mention that in cities, we should involve the communities to having better capacities to manage the health risk associated with emergency and disasters. So some lessons learned from the COVID-19 pandemic is that we need to strengthen political leadership that makes the difference. That we know that preparedness is what all people do to protect each other, and the preparedness and the response start with the community. The impact of a pandemic goes beyond immediate health effects. As you may have seen, it has several effects, not only from the health, but also from the social and economic aspects. And also that the current measures of preparedness are not predictive. That's why we need to work together. And we have to remember that no one is safe until all are safe. So we do have several illustrative examples of some leverable local city actions against COVID-19 coordinated with the national authorities where we believe that health emergency disaster risk management have been practiced and most that has had contributed to increasing the resilience in these areas. For example, in Nairobi, Kenya, with worshippers with information on how to protect themselves from COVID-19. In New York City, in USA, where a website was developed to involve residents in the response. In Islamabad, in Pakistan, we have the example of private hospitals that have offered beds, isolation rooms, and ventilators. In Barcelona, Spain, we saw that they allocated 200 apartments as emergency housing for families in vulnerable situations. And also in Mumbai, India, fever camps have been set up for screening and public venues were turned into quarantine facilities. In Seoul, in the Republic of Korea, social distancing by voluntary civic participation was put in place. It was a very good example of how the communities can be engaged in all the process. So some key messages to finalize this conversation is that the communities are at the front line of disaster and emergency risk management, that the preparedness requires the involvement of communities, knowing what are the key risks and what are the vulnerabilities that need to be addressed across all hazards. And managing risks in communities is key for disaster risk reduction. I'm really happy to have shared with you these aspects, and I'll be more than happy to be in touch with you in the future. Thank you.